I was going to actually ask you, you say answering clinical questions in a rigorous way. What do you actually mean by that?
I think there's always that first step where you're trying to gather information, and you want to ensure that that information is reputable, and I guess you can rely on it. And moving from that first step of gathering information, then if you have a good foundation, you're in a better position to take action or implement clinical decisions.
This is something you and I have talked about a fair bit before. I speak to John about a lot too when we think about the process of applying research to clinical practice. And we've spoken before about the difference between applied research and looking at your basic research. And it seems to me that there's a lot of emphasis now on always looking at applied research, often to the neglect of understanding some of those basic sciences and what principles can come from that. What are your thoughts and perspectives on that?
I think there's a place for both areas of research, and as physios, when we're trying to make a decision or work out what to do, if we can be gathering information from lots of different sources, we have a better overall perspective, and we have improved ability to create a good action plan for that specific scenario. So I guess my perspective is that as physios, we should be looking into applied research and basic sciences, or sort of your more pure sciences. Understanding that as well, with some of the pure true sciences, we're not going to have the understanding as, say, a mechanical engineer or a tissue scientist, for example, but we certainly should have an appreciation for the principles and the key concepts and information that can improve our decision making.
Yeah, I think that's something that we all three share in similar, where we've all done our masters in exercise science, and I think we were all in a similar situation where we felt that that particular component of exercise science was lacking in our undergraduate studies. And for me, one of the things I took away from that is not so much about all the applied research that's done looking at the particular outcomes you see with, say, certain resistance training protocols, but understanding particular principles that you take away from the application of different types of exercise. Like one of the biggest ones I always find that's so useful to remember is, well, one, that we are able to adapt, but also two, that adaptation only occurs when you reach a certain threshold. And this is something that I often find becomes a problem when we look at, say, protocols, and this would be something that I think would be useful to talk to you more about as we go into this, of is that protocol appropriate for the person that you're dealing with, for that individual? And so this is something that, well, again, I'd like to hear your perspective of what kind of framework do you use when you think about looking at research findings and seeing the average of the outcomes from looking at that group of participants, and how do you apply that to the individual? Do you have any particular guidelines or framework that you use to think about how you think of tailoring the program to the individual?
Yeah, really great question, and I'm glad we're talking about this. In that, I strongly believe that it's important to have an understanding of frameworks and data as a foundation, and particularly as we're developing as clinicians throughout our career and improving our knowledge of particular areas, you need to have some level of foundation there. That goes without saying. And aside from having that knowledge, the important thing is that if you have a foundation of conceptual information, that gives you a really strong platform to then diverge or use your clinical nous to adapt to a specific scenario or a specific case that presents itself to you. An example being, if we're rehabbing a soft tissue injury, say a hamstring strain, the thing that's often thrown out is it's a 3-week injury, whatever it is, that's fine. But then from that from that basis, what other contextual factors are relevant, what other things going on in that person's training history or their life is relevant to how you're going to manage them through their rehab. So a few points there, but I think that's my overall philosophy in that it's important to have an appreciation of protocols or frameworks and things, but then we need to take the next step and take into account context, intrinsic factors, extrinsic factors, because that then will permit us to have a far better management plan.